Good day. In this supplement, we will be discussing immediately notifiable diseases and their importance. Firstly, what are immediately notifiable diseases? These are conditions for which reporting is mandatory within 24 hours of finding a suspect case. These include acute flaccid paralysis, adverse events following immunization, also known as AEFI, anthrax, human avian influenza, measles, meningococcal disease, neonatal tetanus, paralytic shellfish poisoning, also known as red tide, rabies, and severe acute respiratory syndrome, also known as SARS. Why are these diseases more urgent to notify compared to others? For one thing, some of these are already slated for eradication or elimination, such as polio and rabies, and a single case is already constituted as an emergency or as an outbreak. Some of these already have a possibility for high mortality, especially in an outbreak. An example is measles, especially among young children. Paralytic shellfish poisoning or red tide is also associated with high mortality among untreated patients. Some of these diseases already have been implicated in pandemics such as SARS or human avian flu. Anthrax is possibly used in bioterrorism. And lastly, adverse events following immunization also have a public health impact and may induce vaccine hesitancy among populations. What is the process of reporting immediately notifiable diseases? The person who has seen the case should gather data regarding the disease, who was affected, what happened, where it happened, when it happened, etc. This should be reported to the city or municipal health officer, the provincial health office, and the National Epidemiology Center. The city or municipal health office and the provincial health office will receive the initial report as well as a follow-up form called the PIDSR form. They will also conduct more investigation in the case and form recommendation to action. On the national level, they will also make a recommendation and also declare an outbreak if necessary. This data should be also given to the World Health Organization. What are some actions about immediately notifiable diseases? The authorities may also give health advisories to the public community of the affected area and advise them on next steps of action in seeking medical care. In some cases, like in polio or measles outbreaks, the government will declare an outbreak and also rev up immunization efforts, such as what has been seen in previous years with giving more vaccines to children. In some cases, source control will be conducted. This may involve prohibiting selling of affected shellfish or livestock, depending on the source of the disease. In some cases, a whole area may be quarantined or isolated. In the case of events surrounding vaccination, there will be escalation for the inquiry since these require much cooperation among other stakeholders. It is important that these should be done as soon as possible to avoid panic and to be able to reassure the public that there is no outbreak or no bioterrorism or no threat to their health and safety. Thank you.